Kaya angat ang bayan. Basta't sama-sama tayo.
Sa pag-ingat buhay.
Para sa ating hanap buhay.
Mas bugas iwas.
Maayong hapon Pilipinas, niya diriya sa PTV Davao para sa ato ang Presidential Press Briefing. Mamayang gabi ay dadalo tayo sa regular Monday Talk to the People address ni Presidente Rodrigo Roa Duterte. Usaping bakuna muna tayo, binabati natin ang lokal na pamahalaan ng Pasig at Las Piñas dahil nabakunahan na nila ang 100% ng kanilang eligible senior population as of July 18. Report ng National COVID-19 Vaccination Operation Center at ang Metropolitan Manila Development Authority. Ang eligible senior population po ng Pasig ay nasa 45,158. Lahat ay nakatanggap na ng first dose. Ganon din sa Las Piñas, nasa 38,615 ng eligible senior population. Lahat din po ay nakatanggap na ng first dose. Congratulations po. Kaya naniniwala tayo na aabutin po natin ang population protection basta tayo ay sama-sama at tulong-tulong. At patuloy nga na dumarami ang ating nababakunahan. As of July 18, 2021, lumampas na po ng 15 milyon or 15,096,261 ang total vaccines administered ayon sa National COVID-19 Vaccination Board. Nasa 4,708,073 ang nakakumpleto na ng 2 doses. Tara na po at magpa-schedule ng inyong pagbabakuna. Walang bayad po ang first dose at sa second dose. Kailangan natin ng dagdag proteksyon para sa ating sarili, sa ating pamilya at sa ating komunidad, maging bahagi ng solusyon. Pagdating naman po sa supply ng bakuna, ay sunod-sunod po ang dating ng bakuna mula nung huli tayo nag-briefing, Biyernes, July 16, dumating ang unang shipment ng AstraZeneca vaccine na nasa 1,150,800 doses na binili ng local government units at pribadong sektor. Sa parehas na araw, July 16, dumating ang unang batch ng single-shot Johnson & Johnson vaccine na nasa 1,606,600 doses. Ito ay donasyon ng pamahalaan ng Estados Unidos sa pamamagitan ng COVAX facility. Sabado, July 17, dumating naman ang latest batch ng Sinovac vaccine na nasa 1,500,000 doses na binili ng ating pamahalaan. Sa parehas na araw din, July 17, natanggap natin ang karagdagang 1,606,000 vaccine na donasyon ng Estados Unidos sa pamamagitan ng COVAX facility. Inaasahan natin na sa Miyerkules, July 21, ay darating ang mahigit kalahating milyon or 562,770 doses ng Pfizer na ating binili. Balitang IATF, kung inyong matatandaan, effective immediately, itinaas ng inyong IATF ang community quarantine classification ng probinsya ng Iloilo Province at Iloilo City mula Modified Enhanced Community Quarantine hanggang July 22, 2021 sa Enhanced Community Quarantine hanggang July 31, 2021. Yan ang nangyari sa Cagayan de Oro mula sa naunang MECQ classification na hanggang July 31, 2021, effective immediately, ang Cagayan de Oro ay nilagay sa ECQ hanggang July 31, 2021. Samantala, ang siyudad ng Hingoog sa Misamis Oriental ay nilagay sa ECQ katapusan ng buwan. Makakasama mo natin ngayon po, hindi lang po si DOH Yusek Maria Rosario Vergere, kundi pati po si Yusek Vega at si Dr. Audan para bigyan po ng karagdagang detalye. COVID-19 updates naman po tayo. Itong ranking ng Pilipinas sa mundo ayon sa John Hopkins, number 23 po tayo pagdating sa total cases, number 31 sa active cases, number 131 po tayo pagdating sa cases per 100,000 population, at number 87 po pagdating sa case fatality rate na 1.8%. Sa Southeast Asia, nasa panlima po ang Pilipinas sa bilang ng active cases. Nasa 47,119 mga aktibong kaso as of July 18, 2021. Sa parehas na petsa, according sa World Meter COVID-19 data, unang Indonesia na mayroong 542,236 na mga aktibong kaso. Pangalawa ang Malaysia na may 124,593 na mga aktibong kaso. Pangatlo ang Thailand na mayroong 116,135 na mga kaso. Pang-apat ang Myanmar na mayroong 62,662 na mga kaso. Papatuloy po lang natin ang ginagawang mask, hugas, iwas at bakuna at yung ating prevention, detection, isolation, at treatment. Sa mga bagong kaso, ito ay nasa 5,411 ayon sa July 18, 2021 datos ng DOH. Samantala, mataas pa rin pong ang ating recovery rate na nasa 95.1%. Nasa 1,433,851 na po ang bilang ng mga gumaling. Samantala, malungkot namin binabalita na nasa 26,714 ang binuwian ng buhay. Nakikiramay po kami sa mga naulila. Nasa 1.77% po ang ating fatality rate. Ito naman po ang kalagayan ng ating mga ospital. Sa buong Pilipinas, 55% lamang po ang na-utilize na mga ICU beds. 46% po utilize ang ating isolation beds. 43% utilize ang ating ward beds. At 35% utilize ang ating ventilators. Sa NCR, 42% lamang po ang utilize ICU beds natin. 39% utilize ang isolation beds. 33% utilize ang ating ward beds at 33% din po utilize ang ating ventilators. Sa iba pang mga bagay, inaaprubahan ng Pangulo ang rekomendasyon ng Department of Education na ang pagbubukas ng klase para sa school year 2021-2022 ay sa September 13, 2021. Samantala, maaari nang magsimula ng mas maaga ang mga klase ang private schools at non-DepEd schools provided walang face-to-face classes at mga nasabing paaralan ay stricto magpapatupad ng distance learning modalities. Dito po nagtatapos ang ating presentasyon. Kasama po natin ngayon live in Davao City. Unang-una po si DOH Undersecretary and Treatment Star Lipodo Vega, DOH Yusek Rosario Vergere by Zoom, Iloilo Governor Arthur Defensor by Zoom, and Cagayan de Oro Mayor Oscar Moreno by Zoom. Kasama rin po natin si Dr. Audan, siya po ang Director ng Southern Philippines Medical Center, ang pinakamalaking ospital dito po sa Southern Mindanao. Unahin ko na po muna si Yusek Vega. Yusek Vega, as treatment star, ano pong mga hakbang na ginagawa natin para paghandaan po itong nakapasok na Delta variant na sadyang mas nakakahawa at mas nakakamatay? Yusek Vega, the floor is yours.
Thank you, Spokari, and good afternoon to all. Alam niyo itong COVID-19, lalo na pagpasok ng Delta variant, ito ay nagbigay ng big concern sa Department of Health at saka sa buong agency ng government. In fact, kung titingnan natin, since last year at saka yung surge of April this year, nagkaroon na kami ng mga lessons learned, kung ang treatment nito ng COVID at saka kung paano paghandain natin kung may surge itong taon na to. Ang tinitingnan po namin una ay talagang palaki ng kapasidad ng mga hospitals, lalong-lalong na sa mga level 3 hospitals, na magkaroon sila ng sapat na intensive care units at saka resources kagaya ng mga ventilators, high flow oxygen, and definitely yung mga medicines na pangangailangan talaga ng COVID-19 severe and critical patients. Ito po ay binigyan namin ng mga private at saka government hospitals ng isang contingency plan kung aakyat ang bilang ng number of cases natin ng COVID-19. So in totality ang pinapalakas namin ang staffing also ng aming staffing ng hospitals. Makasiguro kami ng mga deployment coming from other agencies, at pangalawa yung mga emergency hiring po namin sa Department of Health. At saka naghahanap na rin kami ng mga resources kagaya ng mga high flow oxygen machines na pwedeng maibigay namin sa mga areas na may high risk. Yun nga since 2 months ago, we have been deploying a lot of this equipment, lalong-lalo na sa mga provinces that would in need of this machine, especially for the management of critical and severe cases. So yan, Spokari, we are now on the preparedness stage. We will soon we will move to a later stage if there is a surge, and that's going to be the response stage. And then finally, if ever na magkaroon talaga ng mataas na surge, kagaya ng April, then we move towards our plan of the surge situation. So maraming salamat po, Spokane.
Maraming salamat, Undersecretary Vega, joining us live here in Davao. Puntahan naman po natin by Zoom, no? Ang gobernador po ng probinsya ng Iloilo, Governor Defensor. Governor, ano po ang mga hakbang na pinapatupad nyo ngayon? Ngayong tayo po ay naghahanda sa nakapasok na bagong Delta variant. Oh. The floor is yours, Governor Arthur Defensor. Okay, balikan natin si Governor Defensor. Kasama rin po natin on Zoom. Nandiyan na ba siya, si Governor Defensor? Okay, go ahead, Governor Defensor, the floor is yours. Ano pong mahakbang na ginagawa ng probinsya? Ano pong mahakbang na ginagawa ng probinsya ng Iloilo para paghandaan po at palakasin ang ating healthcare capacity? Ngayong alam natin na narito na
we are really trying our best so that we can have a healthcare system na sanay sa COVID-19 prevalence, the surges. We are really trying our best so that we can have a healthcare system na sanay sa COVID-19 prevalence, the surges, saka lalo na sa pagdating ng Delta variant. Talagang to make a significant increase and concrete increase in the capacity of our tertiary hospitals, no, to attend to our severe and critical cases kasi naniniwala kami dito na kung maasikaso lang natin ang mas severe at critical cases natin at maiwasan natin ang severity at saka mortality, hindi ganong malaki ang problema natin. No? On the side, ang aming facilities like our provincial ligtas COVID-19 center dito, which is already DOH accredited, we have prepared it as a step-down facility and a holding area, no, sa mga pasyente natin na manggagaling sa hospital. And we are prepared to extend this to our establishment accommodations kung kailangan natin. So yan talaga ang pinagtutulungan namin dito, na masanay namin yung healthcare system ng probinsya at ng syudad ng Iloilo para na masikaso natin ang prevalence at saka yung surges natin, especially kung dumating man ang COVID-19. Again, ulitin ko yung pinapagtulungan namin lahat ito kasama ang DOH, yung konkretong adjustments, no, sa ating tertiary hospital capacity to take care of our severe and critical cases. And in terms of community quarantine measures, we are under ECQ and we are about to impose stricter measures so that we can reduce the circulation of people here in Panay in Region 6 kung baka sakali man may mga Delta variants na kami dito sa ibang probinsya.
Papatayo ba ho kayo o magpapatayo ng mga temporary treatment and monitoring facility to free up yung mga espasyo sa mga tertiary hospital and to dedicate those rooms for the critically ill?
Yes, ang sa tertiary hospitals natin, spokes, kasi ang first line of defense namin sa tulad ng probinsya, like an LGU, like the province na maraming may levels, syempre yung development ng TTMF namin from the barangay to the municipal level. But of course, in terms of mild and moderate cases, and even sometimes severe cases, we have our district hospitals na dinidevelop talaga namin na pwedeng mag-asikaso rin natin ng mga COVID-19 patients. But ang ating third line of defense dyan, no, ang next line of defense insofar as the province is concerned, ay yung aming Provincial Ligtas COVID-19 Center, TTMF, which we have developed, that can serve as a step down and holding area. But ang ating district hospitals kasi spokes, we have an existing memorandum of agreement with our government tertiary hospitals na may sharing of resources kami at handa tayo na tanggapin yung ibang non-COVID-19 patients ng ating tertiary hospitals para ma-decongest namin sila. So we are creating this system of capacitating hospitals and TTMFs together with our tinatawag namin dito na healthcare provider network patient referral system para ma-rationalize namin yung traffic ng patients tsaka yung kanilang ma-regulate namin yung kanilang admission. Kasi na kung ma-regulate siya ng mabuti at ma-rationalize siya, hindi natin ma-overwhelm ang ating tertiary hospitals sa mga patients na minsan pwede nating asikasuhin sa lower levels ba. Kasi minsan may mga body rate tayo na kumakain sila ng bed capacity na ating mga tertiary hospitals kaya unnecessarily na-overwhelm yung tertiary hospitals. So that is what we are doing right now. We are developing this system that can rationalize the admission of patients and the traffic.
Okay, thank you, Governor Arthur Defensor. Punta ka na natin si Yusek Vergere. Ma'am, I will quote Antique Governor, Governor Rodora Cadiao, and she said over the weekend, what's the logic behind putting Iloilo and Iloilo City under ECQ? The Delta variant was not found in Iloilo. It's unfair for Iloilo, end quote. Yusek Vergere, yung pagpapalagay po no, ng probinsya ng Iloilo at Iloilo City together with Cagayan de Oro and Himoog did not go through IATF itself. No? It was directly recommended to the President by the NTF and the DOH. Can you please explain po to Governor Cadiao and to the rest of our kababayan sa Iloilo Province and Iloilo City why DOH recommended directly to the President to put these areas under ECQ? The floor is yours, Yusek Vergere.
Maraming salamat po sa inyong lahat. Po Governor Defensor and to all of our media partners and the public. Gusto ko namin ipaliwanag. Unang-una po ang Iloilo City and Iloilo Province, even before the Delta variant was detected, tayo po ay nakapag-recommenda na dapat na ECQ na po ang levels ng Iloilo City and Iloilo Province. This was because of the continuing trend of increase in 2-week growth rate and average daily attack rate. And these are the primary parameters of our IATF community quarantine classifications. Aside from that, their healthcare utilization rate and their ICU utilization remains to be at high risk and nearing critical risk. And we have implemented NECQ for the past 4 weeks already, but we have not seen an improvement in their parameters. Kaya po na nag-usap ang Screening and Validation Committee, na pag-usapan na baka dapat mag-ECQ na based on parameters, and then we got another information based on the sequencing result na lumabas po ang dami pong alpha and beta variants na na-identify sa Iloilo Province and Iloilo City. And this has led to the recommendation to IATF to have Iloilo City and Iloilo Province na mag-ECQ po. But because we have this process for appeals, ang ginawa po, nag-appeal po sila na sana babaan at i-de-escalate ng hindi ECQ ang kanilang classification. So when we discussed in our Screening and Validation Committee, napagkasunduan po ng mga miyembro ng ahensya na sinabi na okay, we can do MECQ, but they have to commit to improve their hospital capacity. Kasi nakikita po natin kulang pa yung kapasidad nila to manage the current number of cases. So it was resolved in IATF that they will be classified na MECQ pa rin po. But during the time that we were able to sequence, the sequencing results came out, nakita po natin na yung alpha and beta variants ay tumaas, no? At madami po tayo na-detect sa Iloilo City and Iloilo Province. And also, isa po sa pinag-usapan with the National Task Force Head, Secretary Roque, DILG po, at saka yung iba pa hong mga ahensya, na sinabi po na yun pong gateway for Antique, meron pong posibilidad na dumadaan sa Iloilo City or Iloilo Province. Kaya po with all of these considerations, yun po yung nai-recommenda natin so that we can better contain ito pong Delta variant na meron sa Region 6.
Okay, thank you very much, Yusek Vergere. So, it was based on science po, no? At ito po ay yung base rin sa genome sequencing na yung dalawang nasa Antique na kaso ng Delta variant, hindi namang imposible, no? Na meron din connection sa Iloilo Province or City, bukod pa dun sa tumataas na mga iba pang variants dyan sa Iloilo City and Province. Now, okay, puntahan naman po natin ngayon, also by Zoom, Cagayan de Oro Mayor Oscar Morales na ang kanyang syudad po ay nasa ilalim pa rin po ng ECQ. Pero wala pa po ata si Mayor Oscar Oscar Moreno. Just to tell our viewers, nasa Cagayan de Oro po ngayon si Secretary Galvez, NTF Chief Implementer, Secretary Duque, Secretary of Health, at saka si Secretary Anyo together with Secretary Delfin Lorenzana, no? So habang wala pa po si Mayor Oscar Moreno, and we're hoping also that Secretary Galvez can possibly join us to give us the latest mga pangyayari dyan sa CDO, no? Tumuloy na muna tayo sa ating question and answer. Yusek Roque, go ahead please. Yusek.
Secretary Roque at sa lahat po ng ating mga bisita, from Joseph Morong of GMA News for Yusek Vergere, can you give us a profile of the Delta variant versus the other variants? How easily transmissible is this? Can fleeting encounters infect you? Is this hyper-communicable?
Yes, Yusek Roque. We just want to emphasize that this variant, the Delta variant, is highly transmissible at napakita na po ito sa mga experiences across the globe. Base po sa ebidensya, sinasabi it's 43 to 90% transmissible than the UK variant. Patatandaan po natin ang UK variant was said to be highly transmissible and it can infect about 3 to 5 persons. Pero ang Delta variant po can infect up to 8 persons in just one sitting. Gagawin ko pong example yung nangyari sa Sydney, Australia, where a limousine driver was infected with the Delta variant. Sinakay po niya yung mga pasahero niya, dinala lang niya sa malapit lang po na lugar. And with that instance po, madami na po siya na-infect. So meaning it's really highly transmissible, mabilis pong makapanghawa kapag may Delta variant, kaya kailangan po natin lahat mag-ingat.
Opo. Ang second question po niya, given the limitation of our genomic surveillance, is it possible that the Delta variant has been spreading and we're not just able to detect it in the population?
Well, the possibility is always there because as we have said, we do purposive sampling. Ang kung saan ang ginagawa po natin, nagsasample po tayo dun sa mga lugar na may mga matataas po ang kaso. So ito pong posibilidad na maaaring hindi po natin nakita dun sa ibang lugar na hindi natin nakuhanan ng sample. Pero kailangan lang po matandaan ng ating mga kababayan na kung ano man po ang ginagawa nating safety protocols before, let us just try to implement that. Let us assume na kung sakali may transmission na ganyan, ay mapoprotektahan po tayo kung sakaling tayo ay susunod sa protocols and get yourselves vaccinated.
Opo. For Secretary Roque and Yusek Vergere din po, will there be tightening in our protocols given the threat of the Delta variant? Similar question po with Caroline Bongkin ng CNN Philippines. Yusek Vergere.
Yes, ma'am. No? So, ngayon po pinag-uusapan yan. Kung mapapansin nyo, nung na-detect po yung variant na Delta dito nung Biyernes, tayo po ay nakipagpulong na ng mga emergency conferences with our local government officials, local health officials, para po makausap natin sila at may parating sa kanila kung anong dapat restrictions sa meron. Tinignan mo natin ang mga datos at nakita natin na yung mga currently nilagay natin sa ECQ have this increase in the number of cases. So we needed to escalate the restrictions. Ngayon dito naman po sa City of Manila, with the analysis of their data at nakipag-usap po tayo kay Mayor Isko, nakita natin yung mga kaso nila manageable, nakita natin effective naman po yung ginagawang PDITR, so we guided them. Sabi natin, mag-granular lockdown ka muna, but every day we will be assessing kung kailangan natin i-escalate ang restrictions. So So for now, tinitignan ho, makikipag-usap tayo mamaya sa mga eksperto kung ano pa ho yung iba pa hong precautionary measures na kailangan nating gawin for us to contain the spread of this variant.
Opo. Secretary Roque?
Siguro po, dadagdag ko lang na we are aiming to promote total health. No? Alam po natin na there is a necessity na ilimitahan ang pagkalat ng COVID. Pero at the same time, ayaw rin natin tumaas ang hanay ng mga nagugutom dahil sa lockdown. Kaya nga po, gaya ng sinabi ni Yusek Vergere, ating strategiya hanggat maaari, we will have localized granular lockdowns nang sa ganon ay makapagpatuloy na makapaghanap buhay ang ating mga kababayan. Ang panawagan po ng Presidente, mask, hugas, iwas, at kung po pwede na po, magpapakuna na po.
Opo. From Michael Deliso ng ABS-CBN, Yusek Vergere, kumusta daw pong update sa intensified contact tracing sa mga nagpositibo sa Delta variant?
Yes, Yusek Rafi, no, kanina lang po narinig natin si Mayor Isko, nagbibigay na ng update. They were able to identify about 36 individuals already who came in contact with the 3 positive individuals with Delta variant in the city of Manila. Kinakala pa rin po natin ang iba pa hong mga contact tracing results sa iba't ibang lugar. Ngunit masasabi po natin na mukhang nag-work na because we were able to identify doon po sa ating mga local cases na meron na hong aktibo pa rin at na-test na po natin sila and we were able to quarantine them already.
Opo. From Caroline Bongki ng CNN Philippines for Yusek Vergere, ano na po ang ginagawa sa pagpapalakas ng genome sequencing?
Yes po, no? So katulad ng lagi namin sinasabi, we are trying as much as possible to expand our capacity. So yung kapasidad po natin ngayon is 750 runs or samples na natitest natin per week. Pag dumating na po yung mga extraction machines na binili ng Philippine Genome Center, madodoble na po ang kapasidad natin to 1,500 per week. Also, we are expanding through our sub-national laboratories to increase their capacity so that they can also do genome sequencing. And the Philippine Genome Center is now extending the capacity to their Visayas and Mindanao University of the Philippines Network.
Opo. From Lay Alvis ng GMA News for Yusek Vergere, ano po ang update sa Delta variant cases? Ilan na po ang namatay? May report from Antique na may isa na rin namatay doon na Delta variant. Similar question po with Pia Gutierrez ng ABS-CBN.
Yes, Yusek Rafi, no? So katulad po ng sabi natin, 35 total cases of Delta variants in the country. Yun pong naunang 11, ito po lahat ay returning overseas Filipinos. Last Friday, we announced that we have detected another 16, kung saan 11 po ay local cases at 5 po ay returning overseas Filipinos. Among these 35 cases that we have right now in the country, 3 po ang confirmed na deaths na. Ang isa po, yung namatay na 63-year-old male na kasama sa barko na MV Athens at namatay po noong May 19. Pangalawa po yung in-announce natin noong Friday na namatay from City of Manila, 58-year-old female. It's a local case and she died June 28 in a hospital here in Metro Manila. And just yesterday, we were able to verify through the validation of the local government that a 78-year-old female who was also part of the local cases died last May 30. So 3 po ang kabuuang namatay and the rest, yung 33 po, some of them were already tagged as recovered. Pero ngayon po, upon verification, inaayos po natin na mukhang may nakikita tayo na positive pa rin dun sa kanilang mga samples at magbibigay tayong information in the coming days.
Opo. Yung second question po niya, Yusek, nasagot niyo na, yung ikatlong tanong niya, may mga puna na matagal bago lumabas ang result ng genome sequencing. Ano po ang sagot dito ng Department of Health?
Yes po, Yusek Rafi, no? We have a certain number of days where you process the genome sequence. Hindi po siya ganun kabilis katulad ng RT-PCR kapag ka-prinoseso. Ang genome sequencing po may ginagawa pa mga bioinformatics so that we can detect or ma-determine natin yung mga phylogenetic tree, kung baga yung tinitignan ang linkages. So it takes about 5 to 7 days before we complete a cycle para makapag-issue. And that is every week. Nagkaroon po tayo ng mga kaunting pag-antala or delays in the past weeks because yun pong reagents na supply natin, nagka-shortage naman globally, kaya bago po nakarating sa atin ay medyo natagalan. Pero ngayon po regular tayo, we can also do immediate sequencing. Meron po tayong mga maliliit na makina na ginagamit natin kapag meron tayong mga urgent na samples na kailangan natin i-test.
Opo. From Maricel Hadili ng TV5 for Yusek Berhere, kumpirmado ba na may kaso ng Delta variant sa Taguig? Ano po ang detalye ng kaso? Similar question with Pia Gutierrez. At ang follow-up po ni Pia Gutierrez ng ABS-CBN, kabilang ba yung Taguig case sa 16 new cases na binalita last Friday?
Hindi po kasama, no? So we are trying to clarify, wala po tayong local case na na-identify sa Taguig. Wala rin po tayong taga-Taguig na na-identify ngayon pong run natin. Ito pong binabanggit na taga-Taguig ay isang returning overseas Filipino and was quarantined in Silver Oaks at kasama po siya dun sa MV Athens case natin. Ano? But the permanent resident of this returning overseas Filipino is from Taguig. Kaya po yan na-report ng ating City of Taguig. Pero hindi po siya kasama sa mga local cases natin.
Opo. Yusek, follow-up ko na lang yung kay Joseph. You mentioned na may nakikita pang positive sa samples. What do you mean? From what samples? You mean there's more Delta variant?
Hindi po. Bumalik po tayo, no? So that is our existing protocol right now. If we detect a specific variant of concern among the population o yung mga individuals na nag-positive po at na-tag na as recovered, binabalikan po natin. So binalikan po natin itong mga local cases natin at ito po ay atin pong pinarantin muna po sila lahat hanggang lumabas ang kanilang resulta dahil nag-retest tayo sa kanila. And among the initial results that we have received, meron po sa kanilang nag-positive pa rin, chinecheck natin ang CT values, and they will remain to be isolated until later negative after 14 days.
Opo. Question from Pia Gutierrez pa rin po. Ano daw po yung posibilidad na may community transmission na ng Delta variant sa bansa? Similar question with Icon Miguel ng UNTV. Ang follow-up po niya, may underreporting daw po ng variant cases. Tanong pa rin po yan ni Maricel Ranini din, ng TV5.
Kailangan natin maintindihan, Yusek Roque, ano po bang objective ng ating paggagawa ng whole genome sequencing? And what would be our process? Simula't sumala pa ho, sinasabi na natin, our genome sequencing, we do purposive sampling. We're not covering the entirety of all of those turning positive because of our capacity. So kapag yan ang ating objective, we cannot say that we are underreporting because the samples that are purposively collected ay nakokolekta po at natetest natin. Pero nandyan po tayo, we recognize that fact na talagang kailangan mag-expand po tayo para mas matest pa po natin yung iba pa natin mga kababayan na nagpo-positibo. So what we can say right now would be we are trying to expand pero kailangan ng ating mga kababayan cautious tayo. So let us assume that there is this transmission so that we will get more protected, we will be more cautious at mas mag-comply po tayo sa protocols kasi highly transmissible po talaga ang sakit na ito.
Opo. From Pia Gutierrez ng ABS-CBN, the DOH says it will recommend to the IATF to reconsider allowing children ages 5 and above outside due to the Delta variant. Ano po ang tingin ng IATF dito? Will the IATF recall its order soon? Same question po yan ni Ivan Mayrina ng GMA News.
Gusto ko lang hong klaruhin, Yusek Roque, we have not recommended that yet to the IATF. What I said a while ago in one of my interviews, we have a meeting with our experts this afternoon so that we can determine if we are going to continue allowing our children or we will recommend that this be temporarily be suspended. Pero wala pa ho tayong nire-recommenda, pag-uusapan ng mga eksperto mamaya at magre-recommenda pa lang tayo kung sakali.
Opo. From Laila Salaveria ng Inquirer, given the possible community spread of the Delta variant, will the government restore restriction it earlier lifted? How likely is this? Or will it wait to see if there will be higher daily cases before reimposing restrictions? Similar question with Pia Gutierrez of ABS-CBN.
Yes, all of our actions right now is precautionary. We would like to anticipate, we would like to be one step ahead kung ano-ano man po ang mangyayari. Kaya po araw-araw, titignan natin ang ating mga datos, titignan po natin kung kailangan na natin mag-escalate agad. Hindi po tayo mag-wait and see, but we will enforce stricter measures. Kung hindi man natin ma-escalate ang ating mga community quarantine restrictions, we have guided already our local governments that they should do granular lockdowns. They should intensify their PDITR response para po mas makontain natin ang pag-spread ng variant na ito.
Opo. For Secretary Roque, a question from Laila Salaveria. What specific directives, if any, has the President given after the detection of local cases of the Delta variant? Will this reduce the number of his activities outside the palace, especially since there are concerns that vaccines become less effective versus the Delta variant? Similar question with Pia Gutierrez of ABS.
Well, una-una po, no, mabilis po naging aksyon ng Presidente nung nagkaroon ng direktang rekomendasyon ang DOH at ang National Task Force na ipasailalim po ang mga probinsya nga ng Iloilo at ang syudad ng Iloilo kasama ang CDO at ang Hingog under ECQ, no? Ang Presidente naman po ay nagre-rely sa mga expert opinion ng mga dalubhasa na taga-DOH at mga taga-NTF, no? And will not hesitate, in fact, to increase yung community quarantines if there are grounds to do so. At napakita na po niya yan. Ang hinihingi lang po ng mga presidente, ng ating presidente, lalong-lalo na sa mga lokal na pamahalan, ay ang kanilang kooperasyon. Hindi naman po tayo mag-i-impose ng ECQ kung wala pong dahilan. Alam po natin mahirap ang ECQ, pero pinagdaanan po yan ng NCR plus 8. Isang bagay na hindi naman po pinagdaanan until now ng mga probinsya na nadedeklara sa ECQ. Mas matagal po yung naging ECQ at MECQ dito po sa NCR plus 8. But when we have to resort to it under the goal of promoting total health, hindi po nag-aatubili ang ating presidente. Na kung makaka-apekto po ito sa mga ikot na ating presidente, simulat mula naman po, limitado na ngayon talaga ang limit ng ating presidente, ang movement ng ating presidente, pero siguro po ay depende rin niya kung saan pupunta po ang ating presidente at kung ano yung kahalagahan ng mga affairs na pupuntahan niya. Pero ngayon naman po, ay consistent naman po ang pattern of movement ng presidente unless mayroong extraordinary affair, nasa Malago po siya o nandito sa siyudad ng Davao.
Opo, a question from Joe Montemayor po ng Malaya. Approval of comment on call if BSWD Region 6 for provision of cash aid to poor families affected by ECQ in Iloilo City and Iloilo Province. Will cash aid also be provided to CDO and Bingoog?
Kakaroon po ako ng kasagutan dyan sa Miyerkules, ang susunod na ating press briefing. No? Dahil yan po ay pinaalam ko na kay DBM Secretary Avisado at titignan po natin kung merong ganyang ayuda na maibibigay po. Pero alam naman po natin na kapag tayo nagdedeklara ng ECQ, merong ayuda. Hindi ko lang po masabi ngayon if definitely kung lalabas siya at kung magkano. Pero by Wednesday, we hope to have the answer po.
Opo. From Trish Terada ng CNN Philippines, how does the government plan to address the very slow contact tracing and detection?
Well, ngayon po, pinabibilis na nga natin yung proseso ng contact tracers. Humingi na nga po ang ating mga Metro Manila mayors na manatili yung mga additional contact tracers na kinontrata po ng ating Department of Labor. At tingin ko naman po, with this development, wala pong hadlang para manatili itong mga contact tracers at palalawakin pa po natin to. At at the same time, yung mga iba't ibang mga LG po ay i-interconnect na sa kanila ng mga programs at patuloy pa rin po yung nilanais natin na yung Stay Safe Philippines ay magiging central automated data bank para sa ating mga COVID cases. Perhaps, Yusek Vega, would you like to add anything on Stay Safe?
Tama ka yan, Sakari. Itong contact tracing talaga very vital to sa pag-surveillance at saka test tracing ng ating mga index cases. Ngayon sa DILG, tinuloy po nila yung mga number of manual contact tracers local government units. Ito yung isang tracing na hanggang sa second, even to the third degree. In fact, dito nga sa Delta variant, kailangan sa contact tracing aabot sa third degree, para makita talaga natin kung sino ang involved at saka ma-isolated quarantine. At saka pinaigi na rin yung stay safe ng mga local government units at saka ang DICT right now is in top of making sure na yung integration of all LGU applications can easily sync with stay safe.
Opo. For Secretary Roque,
Yes,
tanong pa
please.
rin
Next
po
question,
ni,
please.
tanong pa rin po ni Laila Salaveria sa inyo. What is the President's basis for saying the Vice President is immune from suit when it's not mentioned in the Constitution or jurisprudence? Similar question from with Danesca Panti.
Let's just say perhaps this is an opportunity to provoke jurisprudence.
Yes, Secretary. From Tina Mendez ng Philippine Star for Secretary Roque, can you please comment on the call of Watchdog Contra Daya for the COMELEC to investigate into reports of politicization of the ongoing COVID-19 vaccination program? Contra Daya convener Danilo Arau said the COMELEC should look into the underhanded ways of politicians to promote themselves, saying this is clearly a case of premature campaigning. COMELEC should not be too technical and legalistic in refusing to do something about it.
Well, wala pong jurisdiction ng COMELEC unless campaign period na, no? So, hindi ko po alam kung gusto gawin ng COMELEC yan, pero gustuhin man nila o hindi. Ang pagkakaalam ko sa batas, pag hindi pa campaign period, wala pang jurisdiction ng COMELEC to implement our election laws. Wala pa rin po naghahain ng kahit anong certificate of candidacy, so I think the statement po is bereft of merit.
Opo, ang follow-up po niya, does Secretary Roque feel alluded to?
Certainly not po. I am spokesperson not just for the President but also for IATF, and I consider my role as a spokesperson to be very crucial in promoting vaccine confidence.
Opo. From Edith Caduaya of Newsline PH based in Davao for Yusek Vega po, may question po are about the patient. Ang question daw po niya is about the patient who was admitted and operated with a negative RT-PCR test, but 15 days after confinement, the patient tested positive of COVID-19. What is the hospital protocol for this?
Thank you, Yusek Roque. Alam mo, yung mga kasong dito, ito yung tinatawag nilang nosocomial infections. Pag lalong-lalo na pag nasa hospital ka in more than 5 days, tataas talagang incidence na hospital-borne infections can set in a patient. Ito nangyari po sa kanya, halos on the 15th day, naging positive siya after an operation for COVID. Ito yung masasabi po natin, ito yung part sa nosocomial infection or infection na nanggaling po sa hospital. So ang protocol po talaga nito is talagang titingnan, i-culture sa amin kung may blood culture, kailangan ma-culture, pero it's hard to culture COVID-19. So ang protocol po rito, lalong-lalo na sa mga healthcare workers, is to make sure na meron talaga silang mandatory screening every 14 days. Kailangan i-check, surveillance po to ng mga healthcare workers every 14 days to check whether they have COVID or not. Itong nangyari po sa pasyenteng to dahil sa prolonged stay nila sa hospital at nagkakaroon na talaga sila ng hospital-acquired infections. At nangyari po ito ay COVID.
Opo, second question po niya, how frequent must a hospital undertake swab test to their frontliners? Is it a case of hospital-acquired COVID-19?
Well, it's recommendatory talaga at sinabi na namin noon na talagang for healthcare workers, kailangan talagang 14 days surveillance. They need to have a swab and RT-PCR. So, lahat naman ng mga healthcare workers po natin, sa mga lalong-lalo na sa mga frontliners, na after 14 days, they should be tested for a swab test and an RT-PCR. And that's the recommended protocol.
Opo, Yusek Vega, question from Ivan Mayrina ng GMA News. How much have we expanded our ICU and COVID wards beds? Is this enough? Sabi po ng Private Hospitals Association, hindi lang beds kundi mga trained personnel ang kailangan.
Very true, Yusek Roque. Alam mo, itong paghanda po natin, preparedness for capacity ng hospitals, hindi lang yung space at saka structure ng hospital na talagang i-improve natin and making sure na maka-allocate tayo ng mga intensive or critical cases for those allocated beds, but also the staffing and the services. Ang pinaka-importante dito ang staffing at ito yung tinitingnan pa natin parate na kung pwedeng through deployment of from other agencies, itong pwedeng ma-deploy for certain hospitals na may high risk, or yung tinatawag na namin yung healthcare augmentation ng mga healthcare workers. Ito yung mga pamamaraan na talagang magkaroon tayo ng sapat na staffing, although challenge pa rin ang paghanap, no, or even for healthcare worker to commit themselves. But so far, since April, maganda pong aming ang experience and track record for healthcare workers augmentation, dahil sa nailabas namin mga 3,500 positions, nakakuha po kami ng 97% ang nag-commit to work as a healthcare worker.
Opo, thank you, Yusek Vega. Yusek Berhere, may tanong po si Laila Salaveria ng Inquirer. Kailan daw po darating yung bagong extraction machines, and ano po ang ideal number of samples na dapat i-sequence para mas makita ang accurate picture ng presence ng variants?
Yes, Yusek Rafi, no? So yung extraction machines po is undergoing the procurement process already. So we just need to wait because we know that there are certain processes of government that takes time. Pangalawa po, yung appropriate or the ideal when you do whole genome sequencing is at least you are able to do whole genome sequencing among at least 5%, no, of those being turning positive dito po sa ating bansa. Sa ngayon po, nasa 1% po tayo ngayon, and we aim to expand our capacity so that we can reach this ideal number.
For Secretary Roque, from Buena Bernal ng CNN Channel News Asia, as President Rodrigo Duterte enters his final year in office, analysis said the single most enduring program of the Duterte administration with the consequences that will outlive his term is his war on drugs, which has left a death toll far higher than the killings of dissidents during martial law. They say the admin will be remembered for its human rights violations more than any other thing. May we ask the palace for a comment on this assessment?
On the contrary po, no, doon sa interview ni Ana Tabunda ng PAS Asia kay Pia, our Pia, no, in Rappler, sinabi po ni Dr. Tabunda na mukhang itong war on drugs po is a promise fulfilled by the President to the Filipino people, no? And because of this, ito ata ang dahilan kung bakit kahit anong pinupukol kay Presidente, hindi po bumababa ang trust at saka ang satisfaction rating ng Presidente. So rather than a legacy of notoriety, I think it will be a true legacy of the President na tinutuon niya yung pangako niya na mananalo tayo dito sa gera laban sa pinagbabawal na droga. And the Filipino people, according to PAS Asia, apparently agrees.
Mula naman po kay Creseline Catarong ng SMNA News, mayroon na bang inihahanda si Pangulong Duterte na listahan ng mga posibleng senatorial candidate na kanyang i-endorse sa 2022 national elections? Kailan po kaya posibleng i-announce ng Pangulo ang mga pangalan ng mga ito? Mayroon po ba kayong initial na idea kung sino-sino ang mga personalidad na ito?
Wala pa po talagang listahan na nalalaman ako, no? At bagamat nababanggit palagi ni Presidente ay ilang mga pangalan, pero yung listahan talaga ay wala pa po.
Opo. Una na daw pong inanunsyo na posible pa rin na ipairal ang blended learning para sa school year 2021-2022, pero may posibilidad ba na the middle of the school year pwede na ibalik ang face-to-face classes kung maabot na ang population protection?
Well, nakasalalay nga po yan dyan sa ating pagbabakuna dahil ang sabi naman ni Presidente talaga, even the pilot para sa face-to-face ay nakadepende doon sa numero ng ating mga kababayan na nabakunahan na. So in fact, humingi na naman ako ng, joining the public po na para nga kung makabalik tayo unti-unti sa normal ay magpabakuna na po tayo. Pag meron na po tayong containment or population protection, may posibilidad naman po na babalik sa normal yung ating pag-aaral.
Sa variant, ano pong masasabi dito nyo sa banat na ito?
kabaliktaran po, no? Dahil nakita nyo naman ang bilis ng desisyon at wala ng bureaucratic red tape na pinagdaanan yung rekomendasyon na ipasailalim under ECQ yung mga lugar na mayroong mga nakitaan ng Delta variant, no? At masusi po nating sinusubaybayan ang contact tracing at mga bagong kaso ng Delta variant. We operate within the bounds of our limited resources, pero sa ngayon po nakikita natin na nakatutok po ang ating otoridad dito sa paglaganap ng Delta variant.
Opo. Para po kay Yusek Venga, tanong po ni Red Mendoza ng Manila Times, with the local detection of the Delta variant, ano po ang mga steps natin to ensure na may hospital facilities tayo? Have we coordinated with the private hospital groups like PHAPI to resolve issues that may rise sa Delta surge?
Thank you, Sir Rocky. Talagang itong Delta variant na pagpasok nito, we are taking the precautionary steps and preparedness, especially in the capacity of the hospitals. Ang ginawa po namin, naghingi kami ng contingency plans, lalong-lalo na sa mga level 3 hospitals at saka sa private hospitals. Doon naman sa mga regional or provincial levels, we have asked yung mga regional health offices to coordinate with the private and the public hospitals kasi sila ang talagang mas magandang coordination down in the provincial and the city level. So meron na kaming kaugnayan po on the national front with all of the big level 3 hospitals together with the provincial and the city hospitals, lalong-lalo na sa level 2 private. So meron kaming we're putting in the system of contingency plans for all hospitals to include government and private.
Opo. From Lanes Capanti ng GMA News for Secretary Roque on anti-terrorism laws, Solicitor General Calida said organization and individuals tagged as terrorists by Anti-Terrorism Council will retain their terrorist status even if the Court of Appeals issues a ruling clearing them of being a terrorist. Is ignoring a CA court order the right way to implement the anti-terror law?
I have no authority to speak for the Solicitor General. Please ask Solicitor General Calida.
From Pierre Reñada of Rappler, President Duterte said he would bring sacks of money when he campaigns for PDP Laban bets. What is the source of this money? Does he know it's illegal to use public funds for partisan political activities and distribute money for votes?
Of course, he knows it's illegal to use public funds for partisan purposes. But there is no prohibition in the Omnibus Election Code to raise funds from private individuals for the candidacies of individuals. No? So that is what the President meant. It's an assurance to his party mates that not only will he physically campaign for them, he will also raise funds for them. And that's not prohibited by the Constitution or the Omnibus Election Code. Unfortunately, democracy can be very expensive.
Second question po niya, if what he said was a joke, why is he joking about the acts that violate our laws and degrade democracy and the integrity of elections? Similar question with Maricel Haridi of TV5.
Do not know where you got the information that funds for election purposes is illegal. It's not. Without fundraising, in fact, no candidate can run, and only the very rich can run if soliciting funds for election purposes will be declared illegal. So on the contrary, that's legal. What is prohibited is the spending of public funds.
Opo. From Luisa Erispe ng PTV, 1 week bago po ang SONA ng Pangulo, nagsagawa ngayon ng protesta ang ilang labor groups na tinawag na State of the Workers Address. Nananawagan sila dahil hindi pa anya napipirmahan ngayon ang anti-endo bill na isa sa unang plataforma ng Pangulo pag upo niya sa pwesto. Ano na po ba ang status ng bill na ito? Nakikita po ba natin na mapipirmahan ito ng Pangulo ngayong huling na taon niya sa pwesto? Maasahan din po ba na sa huling taon ng Pangulo, isa rin po ito sa nakalatag na plano ay solusyon sa unemployment rate na isa sa epekto ng pandemic?
Well, when I last talked to Secretary Bello, and this was I think last week in Cagayan, he reiterated that the anti-endo bill continues to be an administration bill and that it has also been certified as urgent by the President. No? But we leave it to Congress because unfortunately no amount of certification can lead to an enactment of the law if the wisdom of Congress is otherwise. No? But we continue to appeal to Congress to pass this anti-endo law as the term of the President ends.
Opo. From Chino Gaston ng GMA News, yun daw pong pag-address ng government yung PCG na nanaboy daw po ng Chinese Navy warship.
Congratulations po sa ating mga magigiting na PCG. I am sure in due course you will be given the proper recognition that you deserve. Saludo po kami sa inyo.
From Pia Gutierrez ng ABS-CBN, will government limit the number of attendees of the President's SONA due to the threat of the Delta variant? Will there be changes in the protocols that will be implemented for the SONA because of this?
Opo, limitado lang po ang pwede mag-attend ng SONA. At ang sabi po sa akin personal ni Speaker Velasco nung Sabado, ay kapareho lang po ng numero ng nakalipas na SONA. Magkakaroon po siguro ng ilang mga pagkakaiba. Ang pinag-uusapan ngayon ay yung saan gagawin yung rapid test at saka yung antigen test. Ang mungkahi daw po ng PSG ay doon na sa North at saka sa South Lounge, samantalang ang mungkahi naman ng Kamara ay doon pa rin sa